they are at 15 and their heart is really high up, you will want to adjust that. This is a general rule for the majority of people. That doesn't mean that it's going to be everybody. Okay. And the purpose is to make sure that there's no pericardial effusion or pleural effusion going on here for this patient. And then the focus should be below this back wall. Okay, I'm going to hit save 2. It's going to take a clip. I know I've taken a clip because it shows me the film strip. So if you are not sure if you took a clip or a still, look on the right hand side of your thumbnail for a little film strip. Then I'm going to decrease my depth, and when I do, I have to move my focus. This is too far in because I'm cutting off my atrium, so I'm going to back off 1, and I'm going to make sure my focus is down at the bottom, and I'm going to take a clip. Okay, so this is what's called filling the sector. I've filled my whole sector with this, but I'm not cutting off my structures. Okay, the next thing I'm going to do is I'm going to take my focus up here, and I'm going to move it to about the middle of your aortic valve. On most people, it is best to be in the middle instead of down below. So if we're below, it needs to be kind of on this line, and that can be hard to do depending on your patient. It needs to be on the line with the bottom of the aortic wall in the LA where they come together, but for most people, the middle of the valve is best. So I'm focusing on the valve, the aortic valve, and I want it to really pop. I can roll my knob here to zoom, and I can even move this box over some so that I can position this where I want it. And then there's another feature you can use with zoom, without zoom, doesn't matter. It's called field of view. And it just increases your frame rate because you're decreasing your sector width. It is a little tedious. You have to use your trackball and the kidney keys. And so what I'm going to suggest when you do this, because people will be tempted to leave this for the color clip, you want to make sure that the anterior mitral valve leaflet stays in with your aortic valve and LVOT. And then now I'm gonna zoom it and get closer to it and take a clip. So you have options there. You don't have to do all of those steps. Okay. So now what we're going to do is we're going to skip the measurements. Notice that there are several, and then we're going to go to the clips of color. Yeah, we'll go back over 2D and then mode later. Let's go over color.
She's
so
skipping that.
I'm going to open up my field of view. If it is green, it's still active. If I turn it off, this is how it's set. So I'm going to turn it green, and I'm going to roll my trackball all the way back out. So now I have my full sector. And notice I'm kind of moving around because I'm trying to pull on her ribs to pop out her structures the best. And I'm just kind of using my TGCs to clean it up a little. Okay, so now I'm turning color on. For the first color box, I want anterior mitral valve leaflet, which is part of LVOT, whole LVOT, and the aortic valve. I don't need to be super far back on the aorta. If I were to see something, I would take an extra clip, but you have to have this stay in throughout the whole cycle, like whole set of cycles, all the frames, okay? Your cycle is like 1 EKG. Notice there's multiple. Okay, I want to see over this aortic wall in this part of the interventricular septum because I want to make sure that there is not a shunt. I want to see the flow going through the valve, and then I want to see the LVOT. So I'm going to take a clip. Once I've got that set, now I'm going to pull my box down, and notice that it changed size, just me moving it. So move it first, then adjust size. Okay, So what I want is to be at the back of this LA, cover the whole thing, and then I want a little space in front of this valve. So notice when I move it out, it makes it wide on both sides. So I'm going to relocate that. And I'm mainly focused on the flow here and here. Now I'm gonna move my box again, and I'm gonna move it all the way to the edge of my sector. So that's the edge. And I've already looked at parts of the LV flow here and here. So I don't necessarily have to cover that space again, so I can make this box more narrow. Or I can keep it a little wider. I'm gonna keep it a little wider for her just because I wanna make sure that I've covered the whole septum. So notice I'm not down below the heart wall. Okay, you don't need to do that because the flow is gonna be inside the heart. But I am up here a little bit higher because I wanna make sure there's not a hole in the heart, there's no shunting flow going across that septum. And I'm gonna take a clip. Again, Save 2 does your clips. Okay. So that should be 3 color images. Now I'm gonna go to RV IT. This is where I was talking about. I'm staying in the same window. I'm not changing my notch. You don't move the tip of the knife. You're leaning the whole knife to the side. So you're leaning the probe, and I am gonna slide in that space diagonally up and down so I can see what's better. Came down a little and I'm pulling against her rib. This is the right ventricle, right atrium, tricuspid valve. The tricuspid valve will open up onto your image. And if I get anchored here a little bit better, here's IVC and coronary sinus draining into the right atrium. Now I want, again, because we're gonna focus on the tricuspid valve here, that's the main focus of this, I'm gonna try to put my focus somewhere in the middle of this valve. And I've got a little leeway because it's tilted. So I can put it in several different places and still be in the middle of the valve, but I'm focused on what's best for her. So now I'm gonna take a 2D clip. So I've taken that, and now I'm gonna put color on. And what I'm looking for here is any sort of regurgitation, because regurgitation is more common than stenosis. So regurgitation means that I have backward flow in the heart of the valve. So the flow is going from here to here. So when this valve closes, if there is backwards flow, that's regurgitation. So what I'm doing is I'm going to size my box to cover the right atrium. And here we can see one of the veins coming in. And I just want to make sure it's wide enough to keep the valve in throughout the cardiac cycle. And I want to see flow on both sides. And I'm going to take that clip. Now she does have a teeny tiny bit of regurgitation. Most people do. And I'm not seeing it every single cycle, but right here. So the leaflets are closed. The flow is going backwards. So away from the transducer, in this case, is blue. And so that's how I tell there's some regurgitation. So you have to freeze it and you have to scroll through, particularly when you are new. It is not cheating. You are not doing something wrong. You can take an extra still image if you want, showing me that you did this. It's not required, but it can be helpful. So often, a lot of times students are like, I feel like I'm cheating because I can't see it live. Well, you will eventually see it live, and every person who has ever scanned ultrasound, cardiac ultrasound, has had to learn to freeze and scroll back, okay? So about 90 some % of the population will have a little bit of regurgitation. So this is trivial. It's really close to the valve. It doesn't go very far back. It's not very wide. And notice other colors are in that. That's called turbulence, but notice that it's really close to the leaflet. This means that it's not very significant at all, okay? All right, so that's all that's required. There's those 2 clips, even though I took some extra pictures to show you that. So now I'm gonna go back. So I was leaning towards her right hip. Now I've come back in the middle where her peristernal long axis of the LV is. Now I'm gonna angle to her left shoulder, and I'm gonna slide in a diagonal along that line to see where's the best place to view her RVOT. This is legitimately the hardest view to visualize and echo. So I found her leaflet and I'm moving the focus up. This is the right ventricle, and it is the outflow tract portion of the right ventricle. There's the pulmonic valve. You'll notice that the leaflets or cusp are more curved and that they're opening down. Okay, that's one way you can distinguish these 2 views. This is your main pulmonary artery. You have right pulmonary artery, left pulmonary artery. You're gonna take a clip. So now for this, we're gonna do some color and we're gonna do some Doppler. Oh, no, not here. Sorry, I apologize. We're gonna do color. We're gonna do 2 color clips. The first one is gonna be showing the valve and the arteries the best you can. So the width only has to be the width to keep the walls and the valve in. So it's really going to be different per patient how skinny. So when I say that this is the skinny long one, that is relative to your patient. So don't get stuck in thinking the box has to be one specific size. Okay, so I'm taking clip here. I can already notice that she's got a little PI. Again, PI is pretty normal for a good portion of the population. But I want to really focus on that and get the best imaging of that. So what I'm going to do is I'm going to take my color box, I'm going to make it shorter and a little wider because the jet can curve around into the right ventricle. So you've got to accommodate that. Oftentimes on a lot of patients, this right ventricle will get wider here than the main pulmonary artery. And so that's why we're going to make the box wider. Again, I don't have to go way out here. I'm trying to keep this close to the edge. And I want to see the valve and a little flow below and the flow above. And I'm just kind of pulling against her ribs, watching and seeing if I can get, and notice it's not even every single cycle that she even has this. This is a little more intermittent. So I took a clip. Notice I took a clip after I hit freeze. If you hit freeze, don't feel like you've lost your clip, it saves it. So the clips are retrospective. They take the last like 3 seconds. And so do not worry about that. Okay, now we're gonna move on to short axis. So I'm gonna turn 90 degrees and I'm gonna actually slide down to a different window. Notice I had to slide up on her diagonally, so I'm gonna slide down in a diagonal. And if I were to turn back 90 degrees, I'm at this peristernal long axis. Turn back for short axis. And the heart is starting to look like slices, circular slices. Your focus for this, you want to be in the middle of your LV. This is your LV. And I'm gonna bring my TGCs up, brighten them up where they're out here, because I really wanna see these walls. And then I'm really kind of pushing and anchoring behind her rib. Sometimes because of lung interference, a little, this haziness over here, some lung interference, you might have them pause their breathing. So if you were to take a deep breath in and hold it, my image goes away. Breathe. Now I want you to take a deep breath in, blow it out, and then hold it after you've blown it out. So that will work some. Go ahead and breathe. The other option is just pause your breathing where it is. Hold that for me for just a little bit. And breathe. Okay, I am down below her papillary. As I angle up, I'm seeing these knobby things attached to the wall. And I'm going to find a slightly different window. Notice I'm moving in a circle. I can see the bottom part of her apex better here. So if I found it better, I'm going to take another clip. And now I'm going to angle where I'm at, slightly up. These knobby things, that's the papillary muscles. Notice they attach to the wall. We want to see them attached to the wall. We don't want to see a separation. And I'll explain that in just a second. That just means you're not in the right anatomical place if you're seeing a separation. Her papillary muscles seem like they're slightly different, like levels. Okay, so now do you see how there's like this space back behind that's dark? That's part of the subvalvular apparatus of the mitral valve. So if you're at that, you're not at the papillaries. So I'm gonna go continue to take my beam up to the mitral valve. And again, I'm gonna kind of move in a circle and find the best window for that mitral valve. And keep in mind, these images need to be circular. Notice that sometimes they're looking not quite so circular, and that's part of why I'm moving. Okay, so now you can see the anterior and the posterior leaflets of the mitral valve. Looks like a little fish mouth. I'm gonna take that. Bring my TGCs in a little bit. I didn't mess with where the wall is, but I did mess with the cavity because I can see clearer on the valve that way. So I'm going to take that again. Now I'm going up to the base, and as I angled up, I pulled the transducer down against the ribs, and now we can see the tricuspid valve, the aortic valve, and the pulmonic valve. There will be times you cannot see all of these together. And if that's the case, we're gonna do what's called piece it together. You're gonna angle to one side and get all your images on one side, and then go to the other side and get all the images on that side. But for her, we can see all of it together. So for this, our main focus is actually gonna be our valves, and they're all kind of about in line with each other. So I'm going to focus on putting my actual focus at the level of the mid portion of the aortic valve. And I am going to take a clip. Then I am going to go ahead and I'm going to do, I am going to just show you M mode because there's no measurements on this M mode. This leaflet, a lot of times, may be the only leaflet you ever see on the pulmonic valve. I've hit M mode and I've got my cursor up. I want this line to go through that leaflet, and that's what I'm focused on. And then I'm going to update. And this is what I'm looking at. Now, you can zoom or decrease your depth. You have to be careful when you're doing other M modes because you may be cutting off your structures, but this leaflet and this motion here is what we're looking at. I'm looking to make sure that this doesn't look like the Wonder Woman W. And I'm looking to make sure I have a little bit of a dip here, but it's not real big. That's called your A wave. So this looks normal. Okay, now I'm going to hit B and zoom, take some of that zoom off and go back out on my depth. So now, again, you can either use field of view or zoom or both. If you're going to use field of view, again, you hit the FOV on the touch screen and you roll that in. And then if I click it to set the width, I can then adjust how it's tilted. I'm going to go ahead and zoom as well. So again, I've increased my frame rate to try to get the best imaging, got my focus on the valve for the best imaging, and then I've zoomed up to get close. And I took a clip. So now, I'm going to move my focus down. This is your inner atrial septum here, and you may have to push or pull around to see it real well. You want your focus at about in the middle of it. And I'm going to give a little more depth here so I can see it. It's really what's in the middle of my screen here, in the middle of that sector. So I'm going to take that clip. Now I'm going to take my field of view back out by going to the right with the trackball, and then I'm going to turn it off. I'm done with field of view. I'm going to take my color box, and in the center of my color box needs to be that inner atrial septum. So the color box can be above and below it, especially because the heart's beating. It's going to jump in and out if you don't have your box the right size. So notice I used a little pressure up on the rib. Now I can see it a little bit better. And then my color scale is going to go down to about 46. My color gain down a little. And this is looking for a hole in the heart between the atria. And if I saw flow shunting across, I would point that out to you, but there is not flow shunting across. So anytime we're looking at veins or looking for an area in the inner atrial septum that could have a hole, we're going to lower our scale because it's going to be a lower, slower flow. And if your scale doesn't say accept signals at this velocity, you won't see it. So you have to tell it that you want to accept the signals at that velocity. So the rest of our color clips here, we're going to go back to 60s. I'm going to take this off because where I was for her inner atrial septum is not the best place for her tricuspid valve. So I'm now going to move my focus back up to the level of that aortic valve and tricuspid valve. And I am kind of healing the probe where I'm tilting my image a little. I'm going to put color on. You'll get hands-on with the healing and towing. Okay, I probably slid. Okay, you want the whole atria in here because you want to assess regurgitation and how bad regurgitation may be, and you're not going to know if you're not covering all of your structures. So that means your box, because this tricuspid leaflet attaches over here by the aortic valve, your box is going to go over the inner atrial septum and over the aortic valve a lot of times. And that's okay. I'm going to improve my 2D image here. I think I'm needing more gel. I'm going to try to get this before I put more gel on. Okay. So now I'm just trying to make sure that the leaflets stay in my box. I take a clip, the whole atria, and both leaflets stay in the box. We already know she doesn't have a lot of regurgitation, just kind of a little bit of a whiff. I'm not seeing it every single time here.
Excuse me.
Maybe a little there, not super convincing. So now, notice I'm just moving around. Now I'm going to come to the aortic valve, and again, you can take color off if you want. I'm gonna anchor real good on a rib to see those leaflets. And then this box needs to go all the way around where I can see color all the way around that valve. But that also means that the valve and the root, it all has to stay inside my box throughout each of these cycles, each of these frames, okay? So if there's a lot of motion and it's bouncing out of the top, I can relocate my box or I can make it bigger depending on which works best. And in this case, I just relocated it. I'm gonna take my color off for a second because if you angle just right, you can angle beyond your leaflets. I'm gonna come back where I'm pulling, where I'm seeing her leaflets. These are teeny tiny movements, so notice that means my color box needs to move. I'm gonna do that. And I'm gonna take a clip. So now I wanna focus on the pulmonic valve. I'm gonna get a little more gel because it's drying up. What I want you to notice is I'm never putting these fingers back here. I'm not rotating like this. I'm holding it like this, and these two fingers are literally like I'm holding myself on the patient. So I'm not sliding around. Okay. Looking for her pulmonic. Trying to find her best window again. Notice I'm kind of using slightly different windows for each of these. I'm staying in the same plane, but maybe in a different area of a rib space or a different set of rib spaces. Okay, this is probably the best I can see her valve. See right pulmonary artery, left pulmonary artery. They're splitting here, right ventricle. So again, this is where we say, oh, we're gonna have the long skinny box. You want to cover both arteries, both branches, the main pulmonary artery, the walls of the right ventricle, and the pulmonic valve. I'm gonna shorten this up a little. Notice when I shorten it, it makes it a little wider. So I just need to be able to keep those walls inside my box. So now I'm gonna take this clip. This is where we're gonna look at spectral now, okay? There is measurements with spectral, but again, it's the mode in 2D we're not gonna do today. So this is going to be a continuous wave. So I'm gonna hit my continuous wave, and I'm gonna take my little diamond, and I'm looking at the flow going out of the heart to the lungs. So I see the valve is here. I'm gonna place this close to the valve, but just under the valve inside the artery. Remember that this is a focal zone to give really good imaging. I'm now going to change my sweep speed to 120. I want to start my scale at about 1.6, and then I'm going to see if I need additional adjustment. Your gain for your spectral is on your PW knob, so I'm going to turn it down. Notice it also turns down the volume, but I want the background black. I don't want noise in the background. And then I'm gonna adjust my scale. I'm focused on the flow below baseline. I pulled the baseline down because we've got a little wraparound going on with the regurgitation that we've already seen. And I'm gonna freeze this. I'm gonna hit measure, and it knows what mode you're in. So when you hit measure and you've been in spectral, you're gonna tell it what valve. I'm looking at the pulmonic valve. I'm gonna do the pulmonic valve VTI, which this is a tracing of the flow. And this second knob here, you can roll it until to the right until you see spline. We'll trace these later, but for now we're going to use spline because it's a little easier. It will trace it, but it allows you to plot points around it. You want to stay close to the brightest part of your waveform. Notice I'm cutting off the little shaggy parts. The best description I've heard of this is we're measuring the chin, not the beard.
Okay.
Double click it to make it white. If you don't double click it and you hit save one, it'll go away on you. Save one is for your still images. Okay, so for this one, this is what I'm taking. I'm looking below baseline. So now we already see an indication she has, we've seen it by color, we've seen it by spectral, she has some PI. So now what we're gonna do is we're gonna come back up here and we're gonna look at color to evaluate that regurgitation of that valve or insufficiency. Those are interchangeable terms. And again, I've raised it up on my screen, widen it to accommodate the right ventricle, and then I want to have it show flow at the leaflets and above, and that the leaflets will bounce up and down, so I may have to go a little bit below. But then you also want to make sure the flow stays inside your box. If your flow is hitting your box, not the blue but the red, you need to make it taller. Okay, so I'm going to play around with my angle and see if I can see it a little bigger on one spot than another. Not seeing a huge difference right now. So I'm going to take my click CW again, and this time I'm going to take this diamond, my focal zone, and I'm going to put it on the opposite side of the valve and try to have it inside that little red candle flame. I'm going to click update. Now this time I'm going to give more scale because I'm cutting off here, and I'm going to turn the gain up. Not a lot, just a little, to help me see the edges of the waveform. I'm not trying to fill in the middle of the waveform, I'm trying to see the edges. I've slid. Okay, so I turned it up enough where I can see kind of the edges. You got to remember that there's timing here that you're looking at. So the valve clicks open, the flow goes through, and then it closes. So we looked at the flow going through the valve. Once it closes, that's when it can start leaking. And a lot of times it doesn't end until the valve opens again. This waveform, while we see that there's something here, it's not filled in enough to measure the PI to assess it for regurgitation. We can measure, again, you're going to select pulmonic. This machine calls it PR for regurgitation. I'm going to click VED for velocity and diastolic, and what I'm going to do is I'm going to come to the end of the waveform, and I'm going to say at the end of the waveform, this is the velocity that I have. And I'm going to hit save one. This is not estimating how bad PI is. It's giving me information for the machine to make assumptions on the pressure. It's going to get kind of an estimate on pressures in the right side of the heart. We'll go over pressure half time next week. I'll have to do some drawing to really show you what that looks like. Okay, now I'm gonna go on to mid-clavicular. There's two ways to get it. I can stay where I'm at here and then slide down a little and take my notch and point the notch towards the bed. Okay, and get a mid-clavicular. It is a 4-chamber. It is not an apical 4-chamber. Notice it is tilted this way. An apical 4-chamber will be straight up and down. DeWitt and other sources do not count mid-clavicular as a standard window. So you won't find the example of that in the standard window. I've given you an example somewhere else, but it will look like a 4-chamber, but it'll be more rounded, squattier, and tilted this way with the apex pointing to the right. An apical 4-chamber straight up and down. Okay, the other way to get this, and one of these approaches is going to be better than the other, is to go find a true apical 4-chamber and stay in the rib space that you used to find that, which I'm going to have you roll up a little more for me. Roll that shoulder up. Okay, so I found her 4-chamber. It's kind of coming in and out. And the ribs are curved. So what I'm going to do is I'm going to kind of walk my probe over more midline on her, hence the name mid-clavicular, and I'm kind of having to angle it some. And you can get a 5-chamber or you can get a 4-chamber, and what we want is a 4-chamber if you can get it. Okay, so now I'm going to depth out. Again, we're assessing like if there's any sort of effusion or anything. I'm going to take that and I'm going to fill my sector. I'm going to take that, and then I have you doing one big color box. Now listen, next semester this is going to be different. Here's why. It is far better to have too big of a color box when you start out than too small. You will go into physics, like with vascular, you're going to do a lot more manipulation with your color boxes, okay? Then when you go into physics, you're going to learn about frame rates and how to reduce that with your color and all that. We will work on these being smaller color boxes for mid-clavicular next semester and the semester after. We're not going to work on that right now. Right now, my goal is to see the septum, ventricular to atrial septum, and keep it in this color box. I'm going to take my probe and I'm going to go towards the apex, which means I'm going to go down, and then I'm going to come back. What I'm doing here is I'm sweeping, is what it's called, through the septum, and I'm trying to see if there's any shunt. And so basically I want to start where I can see the left atrium in the mitral valve. I'm going to angle down, and then I'm going to come back where that opens back up, and that's my clip. And then you have to check it and make sure that you got a sweeping motion. I kind of went a little slow. I cut part of it off. Okay. So once you kind of learn to get the image and get anchored, you're going to be practicing sweep and doing it fast, and then you'll get it. Open, close, come back, open.
And with your sweep, you're going like 3 seconds. It does it 3 seconds before the clip, or 3 seconds after.
I'm doing it. I'm taking the clip after I've done the motion. Like when I come back to the left atrium, the left atrium is open. That's when I'm hitting save to, and then yes, it shows the motion I've already done for the last 3 seconds.
Okay.
Go. Okay. That one can be a little tricky, but we'll get there. So now apical 4-chamber. We're probably going to try to stop at 11, and then you guys will just split the hour in half. And then next week, we'll go over M-mode and 2D measurements, and then we'll break off. Okay, so again, we're depthing out, making sure that there's not a bunch of fluid around the heart. Then we're gonna depth in where we don't want to come this deep, or this close, because we're cutting off the back wall of left atrium. So for her, this is where filling the sector would be. You can bring your focus to the mitral and tricuspid valves, because that's where a lot of what we're going to look at is going to be. I'm gonna take that clip, and now I'm gonna fill my sector more by decreasing my depth. And my focus here is going to be her left ventricle. I'm gonna adjust my TGCs to brighten it up. And I want the mitral valve down at the bottom of my image. And I want my focus to be middle of LV, higher if I need to. I can pull it up even higher to look at the apex. Notice it's a little bit difficult to see her apex. I can even change my tint color. And now I'm gonna go, and this is called a sweep to the apex. I'm basic, it's a tilt, is what it is. I'm gonna kind of do what I did for the midclavicular, only I'm gonna take it and stop at the top, and then that's when I take my clip instead of coming back. This is a one-way sweep. I'm gonna go to her apex and hit save to once I get there. You will notice one of two things. Either the apex is gonna look like it goes into a circle, or the walls are gonna look like they just kind of close off. And hers is kind of a combination of both. So I'm literally taking this probe and I'm doing this. And then taking the clip. Midclavicular, I was here, and I'm doing this and then this, taking the clip. It's one way with the apical 4-chamber sweep. Okay, and then we're gonna put color on the left ventricle. Sorry, filling my sector back, putting my focus back. I'm gonna change my tint again. Okay. So now for this, you want to cover the whole right side, and so again, our boxes are going to be a little bit bigger this semester to avoid being too small at the beginning, okay? So there's method to my madness. Okay, so I've covered the whole right ventricle, whole right atrium. I'm going to take a clip. The exact size, position, all of that will depend patient to patient, but you need to make sure that the walls of your ventricle and the walls of your atria stay inside that box. Now I'm gonna focus on if there's any regurgitation of that tricuspid valve, and I'm now gonna adjust my box size to keep their atrial walls inside and the flow above and below the tricuspid valve in. So I'm raising this up where the back wall, I don't have to image below the back wall, but I want to keep these walls in and I want to see that valve. And again, she's got a little blip there. You can again freeze that, scroll through to watch it, and then if you feel like you see something, you can take a still image. So now we want to look at the left side. Next semester we'll be making sure that we're also looking at the septum, but right now I'm focused on the ventricles. So what I want you to notice is the left side can be awful hard to, unless you have a really big box, to get everything. Okay, in one. You can do this, and that works if you've got everything in. Some people, what they're doing is they focus on getting the atria fully in, but is all my ventricle in there? No. So they may take this clip and move on, but you're gonna have points off because you're not fully covered. You can do this as 3 boxes if you want, all together. So you can do the skinny one like that, and then you can come up here and just cover the ventricle so you don't have as huge of a box. And then your next clip is just over the left atrium and the mitral valve, just like what we did for the tricuspid. So you can do 3 instead of 2 clips, that's fine. If you just really have a hard time with that huge box, that's how you do it. But if you leave that skinny box and you cut off the left ventricle, it will be points off because you didn't show the flow. What can be the problem of not showing the flow in an area of the heart? Did you assess the flow if you can't see it?
No.
She's got a whiff of MR too. No. So what happens suddenly if you're sued and you go to court? Did you do your due diligence? Did you do your standard of practice? If you did not put that color box over all of the ventricle, whether that's in a big box or separate smaller boxes. If you didn't do it, somebody can make an argument and you just might not have a leg to stand on at that point. So make sure that you investigate everything. Your standard of practice is going to be checking everything out. Okay, so now that we've done that, we're gonna go to 2 chamber. So I'm gonna take my notch, find my 4 chamber window, take my notch to rotate it to where, or turn it to where it's up towards her left shoulder. And you are gonna have to push and pull on the ribs to really get an image here. So I'm gonna depth out again, same reasons. Now I'm gonna take the beam. I'm sitting now more like, instead of like this, I'm more like this. Now I'm gonna take that beam kind of inferior lateral and her aorta pops in, her descending aorta. Try to get it better. I gotta pull on her ribs again. Right here, this tube. It's kind of coming in and out. Right there. I'm gonna take that clip. Then I'm gonna come back and I guess I didn't make you guys do that, so that's a freebie. Probably next semester. I've got all the different protocols in my head, so it's a little harder when I've taken things out. I'm filling the sector, and then I'm going to do the same thing we did in 4 chamber. I'm going to decrease the depth to where the mitral valve is at the bottom of the screen but not cut off. The focus is higher up, and I'm trying to show her walls. So I might slide around a little bit. I might change my tent. And I'm gonna do the same kind of motion. And I'm gonna go towards her apex. So I know that I have done the sweep because I'm seeing it disappear. She's got a rib that is causing interference. I'm gonna try to move around it, and I can show that sweep a little bit better. Again, in 2 chamber, it'll either look like it's become a little circle or the walls are collapsing in. Hers is more of like a circle. Okay, so now I'm gonna depth back out, going back to my 2 chamber here, and I'm going to continue to rotate my notch towards her right shoulder, and now her 3 chamber has popped in. And for 3 chamber, this is not typically somewhere that we're looking for effusion, so we tend to just do the clip with focus up at the valves, aortic and mitral. Excuse me. We just tend to do this as filling the sector. We don't typically depth out. And you want to see both valves open and close very clearly. If they're not, you either need to lean slightly against a rib or rotate more. Okay, so then we have subcostal. This is the end of the practicum here. I'm going to have you roll onto your back where I can get to your stomach. I'm going to lower the bed. Now I'm going to stand and then lower the bed because I want as much leverage as possible. You need to think of this as like a fulcrum and having leverage. So now And I've been holding the probe the same way the whole time, like this on top and then like this underneath. You can change to this hold for apical, we'll work on that. But for this, and my notch is on the top, I'm gonna hold it overhand. So my thumb is gonna go on the right side of the probe, my index finger is gonna go on this side where the notch is, and the rest of my fingers are gonna be on the left of the probe. I'm gonna kind of come down below her xiphoid process, and a lot of times I like to be close to that right costal margin. When we go to subcostal and you're standing, you squeeze this handle and rotate. You also should be able to lift it up. It's not wanting to. There we go. It has to be like right in the center of where it locks in order to do that. I didn't want to get it goopy. Okay. So now I'm going to hold this again. So keep in mind you can adjust all of this. Have you take your knees and slightly bend them up. This will relax that diaphragm a little. But if she brings them too far in, like I'm gonna whack her knees with my elbows. So you wanna make sure that they're not bringing their knees all the way up. Okay, so I'm gonna go straight midline here. Use a little pressure, and this is her aorta. So what I wanna do is I wanna see her aorta from top to bottom on the screen. So I'm gonna decrease depth and get closer to it. I'm gonna take my focus, and my focus should be below the lowest part of the wall on the screen. So it's going further down in the body here, and so that I want my focus below that. Now I'm gonna use my TGCs to kind of clear out inside the vessel. I don't wanna clear out so much that I can't see the walls. So I'm kind of backing off of it. Now I'm gonna go ahead and decrease depth a little more. And sometimes you'll have to have your patient hold their breath, but I can see it really well on her. So aorta is gonna be midline. Now if I just tilt to her right and give myself a little more depth, I'm in her IVC. So when I'm back to aorta. Aorta, when you're able to see it a little higher up in the body, you will see liver above it. IVC, you'll see part of the liver below it and above it. That's one of the ways you tell the difference. Okay, going back to the aorta, the walls pulsate, but they don't collapse.
Okay.
When I'm looking at the IVC, the walls have a slightly different motion. I'm gonna have you take a deep sniff in. You see that? It collapses and it does this. And then I found her window here. You do kind of have to twist and lengthen, like pivot. It's a pivot, is what we call it on the vessel. If I slide all the way up, here's her heart, but there's too much air here where I cannot see her IVC. Eventually I might be able to show it. Take a deep breath in and hold it. There we go. Now I can see, we were further up here, or down here. Now we're where we can see the IVC going into the heart. That's what you really want. I'm gonna take that, breathe normal. However, I'm gonna need her to sniff. Okay, so now some of that air has moved out of the way because she held her breath and I slid up there, made some adjustments. Now I need you to sniff, deep sniff through your nose. Did you see that?
Yeah. No. I'm sorry. Oh.
It collapsed.
I'm kind of
So
fluttered.
that's what we're looking for. So do it again. And you can take as many of those as you want. but you only have to have one. Okay, so now this is called your subcostal short axis. It's the long axis. The views are long axis of the aorta, long axis of the IVC, but now we're going to look at the heart, and we're truly in short axis on the heart, and that's why it's named that way. So take another deep breath in and hold it. So as she's holding her breath, the heart sits in the left side of the body. So I'm going to kind of anchor my probe in, heel it, and I'm angling to her left, base, or apex, excuse me, to base, and breathe. And I just did a quick sweep. I'm gonna come in a little closer. Take another deep breath in. So this is apex, papillary, aortic valve. Breathe normal. Once you get to the aortic valve, you can stop, but a lot of people, when you're starting, there's a lot more interference here from air because your valves are constantly moving, which was what they're supposed to do. So a lot of people instead will look at the IVC when it starts coming in, then they'll take the clip. They know that they've gone through everything. So take another deep breath in. These are small movements, but done very quickly. Not your sweep. Okay, breathe normal. Now I'm gonna rotate my notch, and then I'm rotating my hand around the probe. I'm gonna give more depth. Take another deep breath in and hold it. Now I'm gonna see the heart in long axis. So this is subcostal long axis or 4-chamber. This is another place where we would depth out. And then I'm gonna depth in to fill the sector, pulling my focus down, and take a clip. And breathe normal. And that should be everything.